Okay, well, good morning, everyone. I hope everyone had a wonderful experience viewing the solar eclipse yesterday. I did not see it because there was so much cloud cover in my neighborhood, but I hope others had better luck where they were. I am delighted to introduce this week's speaker, Dr. Deborah Stienstra. Before I introduce Dr. Stienstra and introduce the talk, I thought I would just remind folks of some of our speaker series housekeeping. Like always, you may access closed captioning using the closed captioning button on the bottom right-hand side of your screen. We will be taking questions at the end. We encourage you to use the raise hand function and ask questions directly to Dr. Stienstra. And if at any point you have any technical issues, feel free to message Sabrina using the chat function. And with that, I will introduce Dr. Deborah Stienstra. Dr. Stienstra holds the Jaroslawski Chair in Families and Work at the University of Guelph, where she is the director of the Live, Work, Well Research Center and professor of political science. Her research and publications explore the intersections of disability, gender, childhood, and indigenousness. Oh my God, I can't believe I just butchered that. I'm very sorry. And identifying barriers to, as well as possibilities for engagement and transformative change. Dr. Steenstra's title of the presentation is Making a Living and a Life, Living Well for Women with Disabilities. And in this presentation, they'll be presenting qualitative and survey research on women with disabilities from various backgrounds and regions who talked about how they understand living well. And with that, I turn it over to you, Dr. Stienstra.
Thank you, Arif. And thank you so much for this invitation to come and talk with you today about our research. I'm coming from the ancestral lands of the Attawandaron peoples and the treaty lands of the Mississaugas of the Credit. It's also the land of the dish with one spoon wampum, or covenant, in what we now call Guelph. Part of the dish with one spoon covenant is a recognition that the land we share is like a dish that we all draw from, and our responsibility together and individually is to ensure that we care for this land, to ensure that we all can survive and thrive. That theme of living well, surviving, and thriving is a focus of the research that I'd like to share with you today. And so, as Arif said, the talk is called Making a Living and a Life, Living Well for Women with Disabilities. Next slide, please. Next slide. Thank you. So today, in today's talk, I'd like to introduce you to the concept of livelihoods, as well as a framework that we use to examine and understand livelihoods. From there, I'll give you some details of our research and the implications of our findings. And then I hope we have lots of time for conversations and questions. Next slide, please. Well, first, let's start. What are livelihoods? Livelihoods are the ways to make a living and a life. They may be individual, as in employment. They can also draw upon family, or they may be part of a community. Livelihoods may be part of a community. Most often we think of livelihoods as employment or income-generating activities that are linked to employment. And it can be an employment in all its variations, part-time, full-time, self-employment, but it can also be market gardening, the arts, informal recycling, or what some have called waste picking or garbage picking. It can be volunteering. It can be care provision. So there are a variety of ways to understand livelihoods. And we've begun to think of it using a livelihoods framework. Next slide, please. So Teresa Lee and I wrote an article that I think has been put into the chat on the livelihoods framework and disability. And I'm drawing partially from that article and the research beyond there. So the disability and livelihoods framework builds on a broader, more comprehensive framework called the Sustainable Livelihoods Framework. Livelihoods more generally help us to think systematically about how to make a living and how making a living shapes our lives. The Livelihoods Framework draws from research and activism in the Global South, primarily, through the Livelihoods Framework from the 1990s on. Our research has been to bring it to the Global North, and specifically Canada, and focusing primarily on the experiences of people with disability. The Livelihood Framework illustrates a pathway or series of questions which help us move from asking just about people's employment, which is actually the end of the livelihoods pathway in our perspective, or ways to earn more in income, to thinking more holistically about making a living and a life. The beginning of the pathway, which is the first box on my left, is called Livelihood Goals. And it asks, what do people do, hope to do to survive and thrive? The next step on the pathway is to consider, what do people perceive as possible for them? What livelihoods choices or options do they feel are possible for them in particular? The third step in the pathway is to explore choices and strategies. What choices do people make around their livelihoods? And the last step, which is about activities and outcomes, is what do people do to survive and thrive? And that ends up back where most people start, which is around employment and income generating activities. The Livelihoods Framework helps us to understand and recognize that people with disabilities, and all people really, are agents. They're active in making choices about their lives and about their livelihoods, although it's often in the context of having to make difficult choices because of barriers and facilitators that are on their path. Next slide, please. Today, I'd like to share with you two research projects. Both are works in progress, so I can't really point you to publications, but I can share them with you when we've got things published. So two projects that have been using this Livelihoods Framework. Both are community-engaged partnership research, working with civil society organizations as full partners, directing the research. Both are funded by the Social Sciences and Humanities Research Council, although they're under different grants. On the left of the screen is an image of a woman with glasses sitting in a wheelchair with the words "Young Women with Disabilities and Pre-Employment Supports." It's one part of a partnership development grant done in partnership with Disabled Women's Network of Canada, DAWN Canada, and the Canadian Council for Rehabilitation Work, CCRW, and their youth through research with the Youth the Future program. The second project that I want to talk about is linked to the logo on the right-hand side of the page, which is Engendering Disability Inclusive Development Partnership, or what we call EDID-GHDI, which is based in 4 countries: Canada, Haiti, South Africa, and Vietnam. I'll be talking about our research in Canada with DAWN Canada again, CCRW again, Realize, and Indigenous Disability Canada. Next slide. So first, I just want to share some of the methods for each of these projects. So the first one, Young Women with Disabilities and Pre-Employment Supports, we gathered initial research in 2 streams. We did a policy analysis of key policies in Quebec and Ontario. We did key informant interviews with policymakers and service providers. And then the second stream was focus groups in French, English, and bilingual with different members of different cohorts of the Montreal Youth the Future site. We were poised to continue our work on this when COVID shut down our research and most of the travel across the country. And for the next 18 months, we weren't able to engage participants either in anything. They weren't able to really focus on research. And so we had to rethink our data collection strategies. With our partners, we chose to undertake a survey through CCRW to reach all of the women in any of the cohorts of Youth the Future across Canada. 30 participants completed the survey, which included demographic questions, quantitative questions, and qualitative questions. We also included questions that linked to the findings of the earlier research to see if the issues raised in the first round of research resonated with this much wider group of young women. As a research team, we met several times to undertake collaborative data analysis and identify key findings. After the initial focus groups in 2020, we developed a summary of key themes. And in 2021, we considered the key informant interviews, the policy analysis, with our final collaborative data analysis session looking at the survey results and an initial intersectional analysis using the demographic survey answers. Next slide, please. For the second project, EDID-GHDI Canada, our methods are slightly different, although some similarities. The country study is a collaboration, as I said, between 4 partners, and civil society partners and researchers from the University of Guelph. Our research team reached out to women in 5 regions of Canada, BC, Ontario, Quebec, Atlantic, and Nunavut, who've not historically contributed to research and or were part of historically marginalized groups, including Indigenous, Black, racialized, 2S LGBTQ+, women and gender diverse people with disabilities, as well as those who have lived in institutional settings or in rural and remote areas. We also conducted key informant interviews with disability leaders in Canada and undertook policy analysis. In each of these areas, we're still collecting data. In the qualitative research, we asked diverse women and girls with disabilities about the supportive and hindering factors that shape their path to livelihoods. In our policy analysis and key informant interviews, we considered how legislative, jurisdictional, and human rights frameworks facilitate and or limit the paths to livelihoods for diverse women and girls with disabilities. Next slide, please. So what was common to the 2 studies? Both used an intersectional livelihoods framework to ask questions and analyze the data. This framework brings together intersectional policy analysis with a livelihoods framework. It's intentionally reflexive, which helps us as a research team to weave together the different data sources using systematic questions, and helps us move beyond a problem-solving approach to research towards one which seeks transformational change. I'm happy to share the framework with you if you're interested. As a result of using a common framework, it's not surprising that both studies asked similar questions. In the young women, we asked, how do you survive or thrive? How have you made your living? In EDID-GHDI Canada, we asked, can you tell us about how you live well or are not able to live well? How have you made your living? We've also, there was some overlap in terms of recruitment regions, but I don't think any participants were overlapping. Next slide, please. So what was different between these 2 projects? Well, the primary difference was in who was recruited. The Young Women Project, we only recruited members of the Youth of Future, women and gender diverse under 30. In EDID-GHDI Canada, we reached out to those from historically marginalized groups and those not usually included in research. Some members of the research teams were different, and EDID-GHDI Canada includes 2 additional civil society partners. Next slide, please. So in general, what were our findings? Our findings were that livelihood goals include, for these women with disabilities, living well and thriving. They also said that the right supports help to change perceptions, their own perceptions and other people's perceptions, and make livelihoods choices possible. And finally, the findings are that making a living is complicated, and employment is part of the puzzle, but not enough. Next slide, please. So what I'd like to do is to take you through each step of the path and illustrate some of the things that we've learned from it. So the first step, if you remember, was livelihood goals. Next slide, please. The women we talked with talked about thriving, and they said thriving for them is feeling empowered and finding meaning in life. And for them, that includes knowing themselves and their goals, having meaningful work. This was really important. Contributing to society, doing fulfilling and impactful work, having confidence and capacity building, having people believe in their skills, being recognized and paid for their contributions, and access to healthcare. Next slide, please. When we asked, what does living well mean to you? These are some of the things that came up. Being able to live a stable life with a roof over your head, a stable job, take care of health and well-being, said one participant. Another said, staying socially active, laughing often, being financially secure enough to live beyond paycheck to paycheck. Another participant said, pushing for change so no one else has to go through what I did. Another said, being able to create a safety net, exploring my creativity and creating meaningful art. And a final participant said, having a part-time, full-time job and being able to pay for your bills and having food on your table. Next slide, please. So if those are some of the goals, what was their perception of what was possible? Next slide. The participants had different understandings of perceptions of what is possible. Some participants faced different structural and systemic barriers, along with having different levels and approaches to family support. And that shaped their perceptions of what was possible within their own lives, as well as the choices and strategies that they made in their decisions about livelihoods. Some of the barriers they identified were discrimination based on disability, inaccessibility, and that's of places to work, places to volunteer, their communities, sometimes their own housing situations. For many of the participants, they felt uncertainty about the future. And many faced a lack of access to supports and material necessities. These barriers combined with other demographic factors to create unique areas for exclusion. Next slide, please. So what were some of the facilitators to living well? Well, for most of them, family and friends was a significant source of support, although it was a mixed blessing. For some, families provided a barrier to their living well, and whereas others, they provided support. And that differed in part by racialization, location, and employment status. And I can get into some of the details of that if you want later on. Some of the other facilitators were clearly having access to income assistance programs, being able to provide self-support and self-advocacy for what they needed. Being recognized as part of a community was a really important facilitator to living well, and having access to resources, for example, access to transit and housing. And that usually meant accessible and inclusive housing and affordable housing. And having access to community spaces like parks, shopping, and community buildings. Without these supportive relationships and access to resources and community spaces, participants said surviving and thriving can be very, very challenging. Next slide, please. So in the survey, we asked, what type of supports do you need to make a living or to live well? And you'll notice in this chart that's on here, doing something I love was one of the most important things for over 80% of the participants. Support from my family or friends, helping others, and recognition for my skills were the next most important set of supports that people needed. Accessibility accommodations came in next, whereas coaching by a professional, mentoring, and other issues came in a little bit later as supports for that. So really it was about having something meaningful to do, and that may be having access to supports from family and friends and helping others. Next slide, please. So the third step on this livelihoods pathway is livelihoods choices and strategies. Next slide, please. The participants argued that they can use barriers and facilitators to make choices and create strategies for their own livelihoods, and that's what they do. So when they know themselves and their own goals, they can make choices about what's possible for them. They also felt very strongly that they needed to have work and livelihoods that were linked to the values that they had. They needed to access information to make choices and strategies. But probably most importantly, they believed they needed to surround themselves with people who believed in them, in their skills and talents. Next slide, please. So the participants said, these are some quotes. So you know you're one step ahead because you know what you want, you know what you don't want, you just need to figure out how to get it. I wish I was there. I'm not. I thought I was, but clearly society has other times. So even when you make all these choices and get the information, sometimes society will throw you curveballs. Another participant said, I really like learning, and that is something that I find does help me thrive. And a third one said, I have 3 human beings, my mom, my dad, and my brother, and 2 feline fur babies at home who don't judge me for who I am, who don't put limits on me, who tell me that I'm capable. Next slide, please. So finally, we get back to livelihoods, activities, and outcomes. Next slide, please. When participants in the survey, when we asked them, how do you meet your needs? For example, food, housing, care, as well as purpose, belonging, income. How do you do this? The most important way for over 60% of them was support from family and friends. Part-time employment, government assistance, and full-time employment come after that. Interestingly enough, creating art was on par with full-time employment. So you'll see some people were involved with trading and bartering, some people were involved in gardening. There were many ways to make a living as these livelihood activities go. Next slide, please. So from this research, what do we take? What is needed to survive and thrive? Paid work is important, but not sufficient. Also, we need to address caring work, volunteering, mental health supports, food security, and housing. Friends and families are important supports, and self-advocacy and support are important tools. Next slide, please. So after all of this, and this may have been a question you had at the beginning, why are livelihoods important? Well, as I hope I've convinced you, often we tell the story about employment and poverty among young women and women with disabilities as one of, there are so many women living in poverty who also live with disabilities. And what this story about livelihoods is trying to say is that diverse young women with disabilities have important contributions to make and are experts in their own lives. So when we begin with their goals and dreams, we can make policies and programs that are proactive, that address making those dreams become a reality. It also broadens how we understand policies and begin to see policies like transit and food security together with pre-employment supports and childcare as necessary interconnected pieces. And it prioritizes the self-advocacy and leadership of women with disabilities within their communities. Next slide, please. So at this point, I would welcome your questions and conversations and look forward to your thoughts on this. Thank you very much.
All right.